It's up to you.
All right, we're going to demonstrate today broaching capabilities of the SurgiSTUD Proximal Femur hip model, which allows us to saw, broach, ream, and fit implants in a beautiful way. So this is a pretty standard size. I'm doing from a posterior approach. The knee would be going up this way. My lesser trochanter's here. My posterior aspect of the greater trochanter is here, and I'm looking right at the femur. So my neck resection is going to be about a finger breadth above over to the piriformis fossa. And got a good neck cut. You can see the cortical structure and the cancellous structure in there and the neck. So I'm going to use a box osteotome now, and because this is straight up and down, I'm going to do a little anteversion in here. Rip my posterior wall. Check out a little wedge of bone there. Cancellous bone. Now I'm going to use a basic canal finder. Make sure that I don't need to take any more piriformis wall. And I've got a little area classically right there that I'm probably just going to run to open that up for the posterior approach. Very normal feel. That's about what it feels like. A real piriformis wall. So now I've got a lateralizer, Christmas tree type handle. This could be power or hand. I prefer hand for the feel of it. And it auto-impacts some of that cancellous structure down in there as well. And also allows me to lateralize against the base of the troch, just like in the real scenario. Bone, SurgiSTUD model handles just like the regular bone in that inferior, in that medial aspect of the wall there. So this is a starter broach. This is a taper fill, a short stem. Go up, slowly get my broach feel. I'm going to go up one, actually I'll just change it up, yeah. Six. And the quality of this bone is such that I could stop anywhere I start getting feel. And I know from doing this that it will handle several different sizes depending on what I want. It's getting pretty solid there. You're actually hearing the difference. And it's got good torsion. I'm going to go up again just to show you. That's going to be maybe this one. Nice solid feel. I can hit it pretty hard, and that's a beautiful feel to the broach and to the implant. I think this is probably the next size up. Let's just try one. But you can see I've got the canal developed. It's holding my line. It's giving me a good feedback feel, just like in the minnow. Now I'm kind of maximizing. I'm not really seating down. So if I wanted to maximize this more, I'd probably have to clean out a little bone. And this is typically going to be a line to line, but either of these last 3 or 4 broaches would have handled in this quality of bone and this type of a feel. That baby's in there, solid, and it's very reproducible. I'm just going to slide an implant in just to give an idea. I don't have my implant. precise feel. This model is easy to change for different aspects. This is kind of a model that could be used very easily in an office for a surgeon to try a different broach technique or a different approach. Easily adaptable to any table. Easily adapted to an anterior-posterior approach too by just switching like that. So here's more of an anterior approach, broaching technique. So it's very adaptable. Little locking pin that just lock it in that position and you're ready to go from an anterior point of view. All right, anything else?
I think that's it.
Yeah, awesome.
Great. Now